My name is Erin Bright, and I'm the co-administrator for Kids First, and I've been with UAMS for 7 years. When children come to Kids First, it's kind of like a one-stop shop. They receive early intervention, therapeutic interventions like OT, PT, and speech. They get preventative health monitoring, nutrition services, nursing care from registered nurses, and it's all provided under the direction of our medical director, Dr. Pat Casey. We use a principle called family-centered care, and what that means is that we look at the unique needs of the children and their families and tailor our services at Kids First to meet their needs. That may be parent education, that may mean extra training and consultation on how to administer medications or do tube feedings. It may be developing a plan of care at home and teaching parents how to play with their children so that they can reach their developmental milestones. We receive referrals on children everywhere from 6 weeks to 5 years. Some children come to Kids First because they just need a little extra push. Sometimes we see children for 6 months, and sometimes children are here with us from 6 weeks all the way up until it's time for them to graduate and go to kindergarten.
My name is Sandra Withers. I'm co-administrator for Kids First along with Erin Bright. My area is the clinical side. I've been with UAMS for most of my career. For the last 20 years I've been with Kids First. Education and health care are very closely related at Kids First. 27 schools send their students to our program to be trained. So that's a really large part of our program.
Being part of UAMS, we have access to a vast network. We're not on campus, we're in 11 communities all across the state, but being part of that UAMS networks helps us be stronger and helps us provide better services to the children and families that we serve.
You think about UAMS being either adults or maybe the NICU, but you don't realize that UAMS has a large pediatrics department. Well, I think anybody who works in a teaching institution knows that what you learn is what you have to teach. It reinforces it. It makes you have to stay on top of your game. It makes you curious because students, they keep you kind of alive and interested in your subject. And so you want to offer them the best. And that in turn, then it makes you better. So you continuously improve. To be able to bring your child who is very, very medically complex to a place where there are nurses to take care of the feeds and the oxygen and the suction and monitoring and make the calls to the specialist and take care of the prescriptions, handle all of that. So it gives you peace of mind. You can go, you can work, you can hold a job, you can be a part of your community in the same way that you would have had you had a child who didn't have all those needs.
A lot of the staff at Kids First have been with us for many years. The families essentially become an extension of the Kids First environment, and likewise Kids First becomes an extension of the family. And that's where our family-centered care model really goes into practice. I think it's very meaningful to have a job where every day you come to work you can feel like you're making a difference.